So there's no need to try to pronounce my surname. Normally my patients just go Niina, Niina, like the ambulance, so it's much more easier. I'm originally from Finland, hence the slightly dodgy accent. I've been in Ireland 22 years, but the accent haven't gone, so it's a... Rory, you make me nervous. The accent haven't gone. Thanks for asking me to speak. I'm slightly intimidated by the previous speakers. I'm quite nervous public speaker. I'm more of a nerd who likes to read rather than speak. But here I am, and I was asked to speak about the role of the clinical nurse specialist in ovarian cancer. It overlaps quite largely with the previous speakers, and I assume most of you have probably met a nurse specialist in the course of your treatment and in the course of your journey. But I'm hoping it might give you ideas what to do if you meet us again, or what to ask us to do for you, because it's really... I went looking for the role and I went looking for the definition of it, and more I looked into it and more I looked into what I do every day at work, I'm not quite sure they are the same job, so we'll see. Now, first, I'm going to look at, I have few slides of where the role came, because it wasn't just that the nurse came in and decided to be very specialized and work in the area, and they're kind of the boring bits, but just to now. So, 1980s, and this is in Ireland, it's relatively new role in Ireland still, over States, Canada, it's much more advanced role. There was a working party, and they kind of noted that they needed more specialized nurses in order to enhance the quality of nursing care and provide services in kind of more specialized areas, because when you do nursing, it's like a GP, you have to study everything. But you know yourself, your needs are very specific and they don't. Somebody who's having their varicose veins removed has very different needs and worries than somebody who's just been diagnosed with ovarian cancer. So there is a need to have people who are more specialized in that area. Also, they were looking into those nurses to educate other nurses how to look after patients who are going through, say, ovarian cancer diagnosis. Commission of Nursing then acknowledged those roles and put through a paperwork. And 1998 then they kind of made a program what qualifications you're required to do, job descriptions, all that. And there's a lot of different nurse specialists in. You can have a nurse specialist nearly for anything at this point. But there is only 9 of us in gynae oncology in Ireland. So I feel very special. There is though a lot of nurses who work, say, on the gynae ward or work on radiation oncology and specialized in gynecology, but for clinical nurse specialist point of view, there's only 9 of us at the moment. I work with Rory in the matter, and I worked with Yvonne before in the matter. So my main focus is I'll be there from the diagnosis all the way through, and that kind of hopefully comes true. So then I went to look for a nice little job description for a nurse specialist, and this is the shortest I could find. You do not need to read it through because it goes 2 slides, and there's a lot of spelling mistakes. Obviously, whoever spots the most might get a prize at the end. There is loads of them. So the biggest thing that came out of those legislation, they defined the role with these core concepts of clinical nurse specialist. And again, they look very fancy, and then when you wonder what actually happens every day, they may not always add. So the clinical focus, the role should be relevant to practice. So it's a nursing role, and you're looking after people on the wards, in the clinics, rather than kind of removed from patient care. So it's not a job where you're walking around hospital with folders and telling other people what to do. It's on your hands and knees beside the patient on the bed. And that, for me, is the best part of the job. And that's why I like my job. It's the fact that I get to follow people all the way through their treatment and management. I have a senior role, but I don't have to do budgets and money and manage other people. I manage patient load, and I get to know my patients very well. big part is also the patient advocacy, and I suppose that's why we're here from point of Ovacare as well. There is so many people you meet through your diagnosis, so many people coming and going, and they all want you to do this. The surgeon wants you to have this surgery, the chemotherapist wants you to have this chemotherapy. So my role would be listen to you and liaise between these people and go, well, did you ask the patient? And what do you want? And if there is questions, to organize time to clarify these with relevant people. And as I said, there's a large role of education and training. I came to the job, it was supposed to be 6 months maternity leave cover for somebody else, and it's over 10 years now I've been doing the job. So I ended up with postgrad in oncology and masters, and seems like there's no other job. I don't think I can get a new job anywhere else. I am in the job now, but it's a job that involves a lot with what you do, and there's a lot of training out there so that you can specialize in your area. But it also involves teaching the staff the latest research and what's happening so that they know that their practice is up to date. There is a role of audit and research which tends to get sidelined every now and then, but we're hoping to catch up on so that we see what we're doing and delivering to the patients. Is it actually making any difference or improving the patient care? And then the biggest role is the consult role. It's liaising between different teams and different people, because there is so many people coming at you when you're in the hospital and out the hospital. So that's officially what I do. But I suppose this is where it kind of overlaps with Rory's talk hugely. Rory went through the phase, what happens when you come into the hospital. I would be part of all that all along, and so I will, when I speak about it, I'll speak about me, but that means nurse specialist. And I try to hopefully clarify what's there to support you through that process that we talked earlier. It is a team approach. There's so many people, so many names. You've been just told that you have to meet all these people and you barely can remember your own name. And it's hard because you have, especially if you're in an outpatient setting, you're meeting people. The next appointment is 2 weeks later. So what I try to do, it's not always possible, resources aren't always the best, is try to keep on track of your appointments so that I can go, this meeting, Mr. McVeigh this week, the scan is next week, we have the scans discussed week after, so that you don't get lost in the process, because you've given all these appointments and where do you go? So I'm trying to, with my best ability, keep them straight lined and make sure that all those steps are followed so that you get a proper treatment and proper management. Also, I worked in a hospital a long time, so I know who to blackmail to get appointments. It's all about being in a hospital 20 years and going, I think you owe me a favor. Will you do this and I'll sort that out? It's very little villagey. After all, it's Ireland. And it goes outside the hospital as well for the community services and voluntary services, so it's a big list. But we do talk to each other and try to work together. So at the diagnosis, you come in and you're ordered all sorts of tests, and again, you're heard the one word, you heard the cancer, and you're sitting there and everything else goes out. I would normally be with the consultant or a senior doctor who will break you the news or gives you the idea that that's what we're looking for. I would stay with you in the room and go, did you actually take anything of that in? Do you want me to write that down? And this is what the test means. And this is why we're doing it. I would give you my contact details so that you can ring me later because you go home and you forgot to ask what you need to ask. And you don't know how you catch somebody in a big hospital because there's all these phone numbers, pagers and bleepers, and who do you ring? The doctors are brilliant, but they're also busy. Our service is surgical, so they're often in operating theater, whereas I tend to be on the ground, so at least you can catch me. And I know how to catch people. I might not be able to answer, but I'm hoping I know where to find people who answer you the questions. And it's about going through in more detail what the test is like. because everybody has different needs. If you've never been exposed to a hospital environment, you don't know what a CT scan is, and it can sound very scary. But if you had a lot of CT scans, you don't need that information. Then the biggest part in our service is surgery. And as Rory said, it is often the main treatment of ovarian cancer, and the aim is to remove all the cancer cells or the visible cancer if possible. And the type of surgery depends on the stage of the cancer. And there is different schedules of planning the surgery. So that all depends on situations. But what involved most of the times is removal of the ovaries, tubes, womb, cervix, omentum, sometimes part of bowel, biopsies. And all that has huge implications for your body image. It's big surgery. You may never been inpatient in a hospital before. Now we're telling you you have to come in and you're stuck in the bed, and you'll be seeing the anesthesiologist, you'll be seeing the stomach care nurse, you have drains and drips. It's a lot of information to take in on the top of being told that you have a cancer. And you don't. So we try to go and drip feed you that information. So let's deal with one thing at a time and put it in the stages and pieces that are much more manageable, because if you take in the whole thing, it gets overwhelming. So we try to balance it out, try to break it into pieces, going, well, this is the day before surgery, this is what happens. This is what happens in surgery, this is what it means. When you wake up, this is what it is. I'd pop into you most of the days when you're inpatient to see and chat and see where you are and taking the information there. A lot of times you don't know the full results of the surgery then a few weeks after. So, but you don't know why, and you've been told you might have a cancer, you most likely have a cancer, and now you have to wait 2 weeks for the results. So there is a reason to it. Everything goes to the lab, is looked under microscope, and as Rory explained, it's very important then for planning your chemotherapy that we have the right diagnosis and the right cell type, and it's becoming more and more important with the targeted therapies. But how do you know that if you've never been through that before? So we tend to be aware that there's a lot of unknowns and a lot of waiting, so we try to make it easier. And it is easy for me to say, because I'm not sitting in the bed and I'm not facing into all this. We also be a good point for family liaison, because your family worries about you and you worry about them, and it's sometimes very tricky. You might have different needs for information than your family do. So with your permission, I talk to your family, and sometimes on their own, so they get to ask different questions than you, but at the same time, my contact is with the patient, and that's my priority. So I wouldn't enter into too complicated things with family. They are there for you, and I'm more than happy to give the information as long as you're happy. But family politics can be tricky, including my own. Then the chemotherapy is different. Again, it's a systemic treatment, and by the sounds of it, most of you have some sort of an experience of it. At that point, we'd normally hand you over to the oncology liaison nurse, who's going to go in a minute detail what to look out for when you're having chemo, what happens, all the risk of infection, and you're looking at medical oncologists, and we're linking you in with those services as well. But we'll be on the background, so you can always ring us and say, oh look, I'm worried about this, and we're all oncology trained as well. But it is difficult time, and there's a lot of issues that can arise at that time, and you need all the support you can get in the world. There's also a lot of practical information how to manage symptoms of chemotherapy and side effects of chemotherapy, and we have resources for that. We have big packs what to do and break it in. We tend not to go through all of them because not everybody has the same reaction, not everybody faces the same problems. There's no point of overwhelming somebody with things that might never happen. So we try to be patient specific, and I suppose that's where it is quite good that you know us from the start, because we get to know you and the way you cope. But really it comes into the fact that cancer kind of changes everything. Nothing feels the same afterwards. It's not to say you need to get to know new you, and it's so much to take in, so many areas, especially with something like ovarian cancer. They talk about altered body image, with losing your hair, you may lose weight, you may gain weight, you may have a stoma. So you don't see yourself the same way. Sexual function can change, you may be tired, pain. Some of the treatments will cause early menopause, so does the surgery. Even just the fear of sexual intercourse and relationships and loss of fertility. Relationship change because your position in family changes and your family's position changes. They will helpless, they want to be involved. The treatment effects on everyday functioning, like Yvonne spoke, you have good days and bad days, but you can't plan those. How do you cope? How do you manage all those things? And the need to protect the family and family to protect you. So you're faced into all these multiple things. There's a lot of financial concerns out there. Things are not easy anymore. And spiritual supports, people have different spiritual beliefs and copings. And so many emotions, disbelief, shock. There's no list that would be comprehensive about those things. So you really need to have somebody who knows you and has time for you and can guide you to the right direction. I by no means am a counselor, but I would have life experience and experience of this. So I'll be able to guide you, but also I'll be able to refer you to appropriate counseling if that's needed and support, and hopefully normalize what's happening, because so many times these ladies coming and they tell me, I don't know, I'm the only one, I'm cracking up and I don't know. And then you go, well, everybody says that, but because it's all new to you and it's all very personal, it's very hard. So that's why the noisy nurse specialist is quite good around to ask you questions. And I suppose the big thing also is what I say to my patients, you don't always feel like talking to me. And that's okay as well. You can say, go away, today is not a day I want to talk about it at all. And it is very important that the information I'm giving to you when I see you is based on what you want to know. It's not a list that I need to deliver to you and I feel it's important you know. It should be what you want to know. So it is okay to say, look, I don't want to do this today. Or can you give me more of that? I try to tell my patients that cancer is not the whole definition of you. It's a big part of your life and it has a huge effect to it, but it's not the whole of you. And even in communication with your family and friends, it's okay to say, well, today I want to talk about soap operas. I don't want to do all this today. Today I just want to be me without all this. And that's okay. Then, I suppose, follow-up. Everybody who comes into us are asking this few questions, and one is, am I cured now? Is this going to come back? How long do I have? These are the questions that you want the answers to, the black and white questions, and nobody's going to answer them to you, and it's really frustrating. And that creates a new fear. But you come into a follow-ups, you come into a checkups, and again you'll meet your nurse specialists. You'll be in the room with the consultant, you'll be in with the chats, and the need of information you need at that point normally changes as well. And you wonder, could I not have a scan every 2 months? Could I not have my tumor markers done all the time? But there are reasons why we try to space this. We try to slowly release you back to your normal life if that's possible. But it isn't easy, and your life's been so focused on treatment and coming in and out the hospital. It's the scariest thing ever. And you go, well, I didn't know I had this first time around, and now you're telling me that I can't have a scan. And then you kind of forget that the scan didn't pick it up at the first place, but sure. It's very scary time, and a lot of times all the emotional issues only arise on the follow-up because you've been so busy surviving and focusing on getting through a treatment. And that's really the time we'd like to link you in with the community services, counseling, peer groups. That's why we're here today as well, because there is a lot out there. This is only a small fraction of things that's available. The clinical nurse specialist is there, peer support groups, what we're doing here in Ovacare. You have a brilliant online forum as well. You've given out so much information, research. Ark House, Kari Kelly Center are brilliant. They are also nice places because they're outside the hospital environment, so it's not a medical place, it's a place for you. And Irish Cancer Society has brilliant backup resources. They'll give you a list of support centers, they give a list of financial supports available. And that's really it. In a way, it's a list of things that are available there, but it just means that I might be able to help you to find those. There's an internet and there's all of those places. I'd be able to guide you where to start, where to find what websites to use. I probably sound like I'm trying to sell my job now, but it's just that you don't have to do all these things alone, and when you land in the middle of it, there is a guidance available.